Hey guys, Dr. Tim here. Today we're going to talk about zinc and coronavirus, whether we should zinc or not to zinc. So zinc plays a really vital role in the body. Because your body doesn't naturally produce zinc, you actually have to obtain it through food or supplementation. Zinc is the second most abundant mineral in the body after iron, and it is present in literally every cell and are required for numerous processes in your body, including things like gene expression, over 300 different enzymatic reactions, immune function, in particular about reducing oxidative stress, protein synthesis, DNA synthesis, wound healing, also things like growth and development in the body, digestion, nerve function. So anyway, the list goes on for quite some time and is really quite profound. Zinc is also utilized for our ability to enhance the sense of smell and taste. And this is one of the things that's relevant specifically as it relates to coronavirus, because as maybe many of you have already heard and noticed, when you get coronavirus, whether it's a common flu kind of coronavirus or another kind of coronavirus, there's often a diminishment in our ability to be able to have smell or taste. And this is directly associated with zinc. There are several studies that are really relevant as it relates to zinc. One study, there were 7 different studies that actually were combined together, and it demonstrated that between 80 and 92 milligrams a day of zinc helped to reduce not only the length or duration of the common cold by 33%. And so that was really quite terrific. The Cochrane Review organization, they did an update to their meta-analyses in 2013 where they took 18 different randomized control trials involving over 1,700 different individuals, and zinc was found to, quote, inhibit the replication of the virus. And so this was really important because the causes of a common cold and the shortening of the average duration of these common colds when taken within 24 hours of the onset of symptoms at a dose around 75 milligrams gave a really positive outcome. So that was another really important one. In 2010, there was another study that looked at how zinc inhibited SARS-CoV-2 in SARS-CoV and the original SARS back in 2003. So these are some of the related to some of the coronaviruses in terms of how they express. And it threw a wrench in how viruses, their RNA was able to synthesize. And so this meant that we were able to disrupt the reproduction of that virus. Zinc is known to relieve oxidative stress and important immune responses in the body by boosting activities of what's called as T cells and natural killer cells, which help to protect the body from infections. Older adults who supplement with zinc experience improved influenza vaccine response as well as reduced risk for pneumonia. So it's estimated around 2 billion people worldwide are deficient in zinc due to inadequate dietary consumption or intake. Those at risk of zinc deficiencies include folks like vegetarians and especially vegans, people with gastrointestinal diseases like Crohn's disease or ulcerative colitis because they can't absorb and uptake many of the nutrients. Pregnant and breastfeeding women often are deficient as well. Older infants who are exclusively breastfeeding can sometimes also be deficient. People with sickle cell anemia, people who have malnourishment issues, and also associated with anorexia and bulimia, those with chronic kidney diseases, as well as those who abuse alcohol, all may have reduced levels of zinc and then potentially other associated issues. Symptoms of mild zinc deficiency can be diarrhea, decreased immunity, thinning of the hair, decreased appetite, mood disturbances and instability, dry skin, infertility, as well as impaired wound healing. That's a pretty long list associated with even just mild deficiencies. So there's certain foods that you want to look for in your diet to be able to make sure that you get adequate amounts of zinc. Those can include things like shellfish, oysters, crabs, mussels, lobsters, clams, as well as meats. Beef, pork, lamb, and bison all also have high amounts of zinc in them. Poultry, chicken and turkey, fish, flounder, sardines, salmon, and sole. And then you can move into some of the vegetable categories like legumes, chickpeas, lentils, black beans, kidney beans, etc. Also, nuts and seeds like pumpkin seeds, cashews, and hemp seeds also have high amounts of zinc in them. Some dairy products, milk, yogurts, and cheeses, also eggs. And then whole grains like oats, quinoa, brown rice, and some others have adequate amounts of zinc in addition. And then certain other vegetables like mushrooms, kale, peas, asparagus, as well as beet greens. There is the possibility of excess zinc leading to a reduction in copper levels, but this is found only in sustained high dosages of zinc in excess of around 150 milligrams a day. The recommended daily intake, RDA, which really is the minimum amount necessary to thwart disease processes, is a paltry 11 milligrams a day for men and 8 for women. Tolerable upper levels of zinc for most in adults is on the order of 40 milligrams a day. And however, this dose does not apply to people with zinc deficiencies, for which we've already indicated is around 2 billion individuals on the planet. So these individuals will need higher doses specifically to use supplementation. So choosing an affordable form of such zincs can be things like zinc citrate and zinc gluconate, but probably stay away from zinc oxidate because this doesn't absorb particularly well. Again, circling back relevant to COVID and coronavirus, it's recommended that individuals take zinc in a lozenge form because this can help to create a slow release of that zinc and also penetrating along the back of the throat and helping with any sore throat or other symptoms. Again, it's important to try and do that not only immediately at the onset of any symptoms, but you can use this also as a preventative measure because so many people are likely to be deficient. So taking those regularly could be helpful. So guys, that was a lot of information about zinc. There's lots of other things that can be useful as well, and we'll get into some of those going forward. Maybe you've heard some of the news recently talking about how zinc can also enhance the outcomes of utilizing some pharmaceutical medications that are applied specifically to COVID-19. And so they enhance the outcomes using those in addition. If you have any further questions, feel free to reach out to us at Optimized Wellness Center. We'd be glad to help you out. So guys, to zinc or not to zinc, well, it seems like you should be zinking. Take care, guys. Dr. Tim with Optimized Wellness Center.